Hi, I'm Hani Gluck, and you are listening to Growing Global. I am passionate about helping entrepreneurs grow and scale their business. I've been an entrepreneur for over 2 decades. I built my own businesses, sold a business, and continue to leverage the global economy. Growing Global is about educating, inspiring, and motivating entrepreneurs or aspiring entrepreneurs on how to take yourself and your business to the next level. Roxanne, thank you for doing this. Roxanne owns a medical billing company in California for the last 35 years. She's on the HBMA board. She serves on multiple committees, the publication committee, the membership committee, education committee. We had the pleasure of working together on the HBMA membership committee. And so she is going to share with us what she does and how she has been managing her remote workforce. Okay, Roxanne. It's all you.
Well, thank you, honey. I appreciate being invited to come on and talk to people about a topic that I'm passionate about. And I've done several presentations over the past few months on managing a remote workforce, and it has changed. This is something my company has done since 2011. And I would talk to people about options if it was something they were looking to explore in the future. And the future had like a 5-year plan. That went away. That's changed dramatically. It's changing every day and every hour. I'm in California. We were put on a lockdown last night. And so it's coming true for anyone that owns a company and needs to put systems in place. So my first question was, did you recently send all of your workers home to work remote due to the COVID-19 requirements? And I did talk with a fellow billing company owner who in 1 day's notice had to send 200 people home. I can't imagine the logistics of that. So I think with the right wall, I would encourage everyone to have a plan on how to do this. I don't believe it's if, it's now probably when. We are still essential business that can stay open related to healthcare that I've read and understood, but you can check with your local state requirements on that. So I think it's interesting to take these questions and think about what you're going to do tomorrow. Or if you've already done it, did you do everything you needed to do? So I would possibly put that plan into place. So when you send your employees home, when we first did it, and in 2011, we did send everyone home with their desks, their chairs, their computers, and some people printers. So we had left an office, gave up the lease, and said we were going home. And so they could take those things with them. And it was a bevy of my van and taking people's information, taking people's supplies to their homes so they could work. So definitely get your compliance officer involved in everything, your IT people involved in everything. There's probably a huge inventory you're going to do to who took things home. Is it according to your manual? Is it their property? Is it your property? If they no longer work for you, then do you go pick it up? There's a lot of kind of technical questions with that. So over those years, if people's computers have died, they are responsible to purchase their own, and that's just something in my company. We have them buy a shell of a computer. I call it a shell, an inexpensive computer, desktop or laptop that has essentially nothing on it. If it was broken tomorrow, you get another one. We try to have everything in the clouds, lots of clouds out there, all over in every cloud, so that they're dialing into those places to work. So it doesn't have to be an expensive computer. When they replace them, I tell them to get the cheapest one they can. That'll do the work with the programs that we have. They have had ergonomic sessions with me on a webcam to make sure their desks and their chairs are comfortable. The same thing you did in the office, they do that at home. You want them to be safe, not be at risk to injure themselves, no repetitive injuries. So are they sitting correctly? And is all that set up the same thing you had done in the office before? Now, the printers, we highly advise not even to send home any printers with anyone. You can remove that HIPAA portion of life, and printer ink and paper and cartridges, everything that goes with that, if they don't have one. So you can outsource secondaries to go through different companies. There's companies that do that, that can print those for you. Ones that will mail medical records for you. There's resources out there. So I've done meetings with clients and not brought any paper. So I might email the reports to them ahead of time, say I'm on my way, we're going to review these, and then I don't have anything in my car on my person. So that works out really well. Are you planning on having this be a permanent setup? Do you want to go back to the office? And I discussed that some more in another slide. And then all of your compliance and security processes. So I had somebody ask me this morning about a policy for HIPAA for people that are working remote. And I essentially said it should be the same process you had in the office. It shouldn't be that different. They still have to follow all the same guidelines, talking on the phone. They need to be in an office with a closed door or in a space that is private. So if they're giving out the social or date of birth of a patient on an insurance call, that's still done following those guidelines. So there's no one behind them that can see their screen. You know, it's not open to somebody outside that could look in and see it. So, you know, the same things with that. I have a barking dog, and it used to be a big issue with me. It's not anymore because 1 million, 2 million, 3 million people are at home with their dogs now. So I don't have to apologize for the dog. Is compliance handled differently now? So we have a couple programs that we monitor people's workflows through. So one is a shadowing program inside my practice management software, and we do that for training. I can go in and shadow them, see their what they're working on. We go through training that way quite a bit. You could also just watch them. We have in the past watched people do a project for, say, an hour or so, and just look to see if they're missing any steps or they're adding in extra steps they don't need. And that works really well. I've heard of a program called Active Track, and I just saw a demo on it the other day because somebody mentioned they were using it. And it'll monitor every single site they've been to, how long they've been on it, and it really, really tracks everything. I don't want to micromanage my employees quite to that extent. We have and I'll review that also in another slide. But I don't want to actually probably spend my time watching every single thing people are doing, because it's just not, you know, productive for me to do that unless they have questions about it. We do go in through the webcam or through a go-to meeting and look at their computers, and I do it as a surprise. I call it Coffee with Roxanne. And it means grab your coffee, I'm going into your computer, and you can sit and watch me. So we can go in and see what's in their emails, what's in their sent file, what they're saving in folders, PHI, anywhere on their computers, not in their downloads. They don't have anything stored in any documents. Like I said, I want it to be a shell. So we do go in and do that. There's just as a part of our compliance plan, and to report anything if we see anything, but a lot of education if anyone's doing anything they shouldn't be. And it's not invasive. It's just, I want to protect them. I want to protect their job. I want to protect my company. So we're going to go look and see how everything is going in there. Their computers are not for personal use. If they want to play video games, search the web for, I don't know, who's selling toilet paper right now, they need to do that on another computer or on their phones, but stay off of these ones. If they get a virus, they're financially responsible to purchase a new computer, and you wouldn't want them to send any emails out or, you know, just have any issues with surfing through the web in places that you shouldn't. So it's nice to help them with that. We did the risk assessment remotely as part of one of the courses that we took. We just picked up the webcam and said, show me your desk space. Let me look behind you. Right behind me right now is another dog, but he's sleeping. You know, who has access to things? And you can do that remotely, just like as if you were in the office doing it. We do recommend they change the password on their home Wi-Fi systems, make it very complicated. A lot of letters, upper, lower, numbers, characters, make it difficult and change it every 60 days. I'm out in the country a little bit, kind of in the mountains, not far out, but a little bit out here. If somebody's driving around here looking to tap into my Wi-Fi, that would be odd, but we want it to be safe and secure so nobody can get into their systems. There's a huge, if you look anywhere, you'll see a huge rise for hackers going after remote billing companies, remote workers, people in banking industry. They are going crazy right now. It's a whole new, it just opened up all new opportunities for them. So we've just had a meeting with my staff this week and talked to them about watching for the emails, hovering over anything before you open it to see if the address is one letter off from where it was before, because they're hitting hard and they're hitting strong and trying to tap into everyone that they can. So it's a whole new, we were used to that, of checking that before, but now it's really gone on to a whole new level than we've seen before. So are you planning to go to a completely remote workforce? And this is what I was talking about. If this is something you're going to continue and long term, I did it, I mean, mainly for cost. I was paying a huge amount of money in overhead for a building, and I wouldn't go back to that cost. And I also like that my employees are home and now definitely. And so when this is over, do you plan on sending people back to the office? And that might coincide with your lease. When is your lease up? I would highly do some soul searching if you're going to re-sign a lease right now for any amount of time. So if your lease is up next year, could you leave everyone home, or, you know, bring them back intermittently until you decide everybody should just stay at home? Just something to consider. It's a plan. I know people might have had this plan, like I said, the 5-year plan, and it just got shortened. So it's just something to think about. You know, could you sublease it out if you had a year left and keep everyone at home? I don't know. And what is the age of your workforce? That's a big question. The millennials, as they say, you know, they like flexibility. I have, probably only 2 or 3 millennials in my company. A lot of the people are older. But if you're sending people home tomorrow and they're not IT savvy, how's that going to play out? We've used different computer companies, IT departments that are remote, because they can log into that person's computer. I have a BA with the one that I use, and they can log in and help my employee, whichever state they're in, and help them with some IT things that never came up before that they had to think about. Even, you know, the virus program is blocking something. How do you unblock that? Before you would have, IT come over and fix their computer. Well, now they're at home. So can you have your IT go remote completely and continue that function, or can you hire an outside company that can go and help people with those pieces? You'd be surprised on how resilient they are. I have a 66, 67-year-old woman in another state, and she can buy a computer, hook it up, set everything up, get it all working all on her own. And she was one of the hardest to train on the computer systems back when I started with her. So they're pretty resilient and can, figure it out. So something to think about, what your 5-year plan now might be really different than it was before. It's keep it with a pencil so you can erase, or definitely on a document you can just hit delete and then change it, because it changes probably every hour now. So once you've sent everybody home, and this is new for people that haven't been home before, how are they going to avoid being lonely and isolated? Their social system was highly attached to working in an office, and that's changed a lot. So how are they going to feel good about this, and that change? Can you set up virtual? So if they were allowed a 10-minute break twice a day, can they either electronically through a webcam, or calling a fellow employee on their break and having a kind of a virtual coffee break, get up and stretch and talk to them, just so that they're still in communication with those people. But I would recommend that they find things outside of those people. Now, it's easier. Before, I would say join a club, join a gym, join a walking group, things like that. I would say go and do that after work. Well, now that we're on lockdown, as they say, that's different. So, but how are they still going to feel connected, and not just social media? Social media should be kept to a minimum, and that's probably to anyone in anywhere in their life right now. It's great to be find out what's going on, but to have it constantly that's all that you're doing and reading and watching, it's quite the downer, and it's hard to continue on and stay positive. So keep their social interactions with their family and friends, encourage that they do that. I still can go, I do virtual walks with some of my employees. So I say at noon today, which I'm doing one today, I'm going to go for a walk, so I can conference call in 2 people, they can conference call in 2 people, and they're all over the US, and we're just in 5 states, but they can pick up the phone and talk to each other while you're walking, same as if you would do when you were together. You can do that with family, and just keep up that communication. There's probably, I know Inc. magazine has put out 1,000 little articles recently on this topic. So a lot of good information to pass along to them. If you're the owner of the company, send things out to your employees to keep them motivated and keep them not feel so alone. You can have team meetings, whether that's the same group that was meeting before. So if your managers were meeting, you still have a managers meeting. I saw one today on somebody, I think it was, Papaya had one on LinkedIn, where they had probably 20, 30 people on the webcams, and they had a meeting, and we do that as well. We're smaller, but keep them involved. We're going to have a brainstorming session on this new change from the insurance since the virus kicked in. This is what we need to do. Keep those up. We need your suggestions, pass it along. If you think of something, that same communication you had before, you will have now. It's just not as face-to-face. You have to, instead of walking into someone's office, you have to call them on a webcam to get face-to-face. Encourage them to do different routines. This is probably one of my routines, but same as when they were going into the office. I've heard of some people that work from home, they're in pajamas, they're hairs on a bun on the top of their head. It's an option, but I think you feel more professional, more inclined that your direction is you're working. When you get up, take a shower, get dressed, I actually put makeup on, and I might only see the postman at the post office in the given day or a banker, but you still get up and you're going to work. Wake up at the same time, try to keep the same hours that you did before, and exercise. I should have underlined that 3 times with a capital E. Hugely important. I saw the funniest thing yesterday on Instagram. A gentleman put dishwashing soap on the floor, held onto the counter, and walked like he was on a treadmill. And it was just a play on, you have to keep exercising. If you can't go to a gym, they have online. Every single workout routine there is online. All of them. And Pilates one's a little challenging without the machines, but all of them. So you can keep that up, and that keeps up, their work productivity, their morale. So that one's, hugely important. I'm a huge walker. I do about 30 miles in a week. That's just my thing. That's my step outside, and it's free. I walk out the door and just start going. But you can still do that. I've said, even though we're supposed to stay in our homes, we can absolutely go for a walk. When I see the neighbor, he's already 6 feet away, so it's not a problem. You have a dedicated workspace that's just for work. I only have maybe one employee who works in her bed, but she's my most productive employee, so I'm not going to mess with that one. She does have a laptop, kind of a stand thing that sits there, but they, have that space that's for that, so it's separated and comfortable, and you have those supplies and the same things. We talked about the same work hours. My employees can flex the start and end time just a bit, but pretty much, have those work hours. I want to be able to contact them. They want to be able to talk to me. So we have that. And then take the same breaks. No, people that work from home do not go and do their laundry and their dishes and clean their house when they're working. I know that's an urban myth, but it's not true. I might put a load of laundry in because I need to get up and move every hour or so and stretch, but it's not like you want to go clean your house instead of working. It just doesn't come up that way. So, but encourage them to get up and stretch and move just like you do when they were in the office. And any kind of communication tools. I only really prefer my employees to call me or email me. I don't want to be doing texting, instant messaging, DM through this program or that program. It's too much. So for them, I want them to just email or call me. If it's it's really important, just call me. I'll answer the phone. Send me an email if there's something you want me to look at and talk about, and then get back to you. But I don't want to get all different kinds of interruptions and bing, 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 bing all over the place, because that's not productive for anyone. So we used to say there's no billing emergencies. They're really maybe right today, but not usually. And how can they share feedback and ask for assistance? Make sure they have tools that they can talk to you. They need help. They don't understand something. They were probably so used to walking in and talking to you before. That's going to be hard for them. I spent hours and hours, I think, with talking to people in my office, and once I went home, I had a lot more time, and I didn't understand that. So maybe it wasn't all work related, but they need to be able to have mechanisms to talk to you and say, I'm confused about something, or I used to work on it this way, and now it's changed, so I need help with that. The first thing we had to figure out when we went home was how you can't hand each other a piece of paper anymore. You can't hand a folder. You can't say, here's this paper to do this with. You can't. We're not touching each other. So how do you share all of those? I use an electronic file cabinet for all the billing and credentialing and payments and everything you can think of. Our providers scan in things to us. They have access. They scan it directly, and we have it in a second. The employees can scan things into, well, that's where they go to access everything. We use Google Docs, Dropbox, different places to put, like my employee handbook is all electronic, our compliance plan is electronic. They can go into those. You can share working spaces. I know Slack is one. You can work on a project together and add notes. We used it for a little while, but we're small enough that we can just talk to each other about the projects most of the time. But now that if everyone's going home tomorrow, do they all have access to the clearinghouse? So I would gather yes, it's probably username and password protected, just like it was before. So they can get into that and work rejections, get the remits, anything that needs to be done. So that hasn't changed. We had a phone system in the office for all those years, and cost was a big fancy one, had lots of bells and whistles. I ended up going with Grasshopper. My husband he's my IT guy, he saw it on an ad, and I think I pay $50, $60 a month, and it will forward calls to any phone, anywhere, anytime. It can take voice message where you can go in and retrieve those, and it's worked really, really well for us. So they also have faxing, but I don't use faxing through them. We use eFax, but there's 100 electronic fax programs probably that you can pick. We are transitioning to have most of our faxes come into our practice management system, so we can kind of skip a step. And our meetings for staff meetings are webcams. We do have in-person ones a couple times a year, probably 4 times a year maybe, but we do a lot of webcam meetings. So we can see each other and have discussions, and they come to the meetings with agenda items, so I get them involved and talking. Don't want to hear it just be me that's talking all the time. So how will you monitor their productivity once they get home? There was a huge perception that by sending anyone home, you would lose control of them. And I had people at a conference last year right in front of me just say, there's no way I could ever send anyone home. I don't trust what they're going to do. And I can't see what they're going to do. Well, you can't see now. I mean, if they're in a cubicle around the corner from you, you can't see them, nor should you. That's not good. That's probably not a good management style. It's different. I think basically people want to do a good job. If you give them objectives and set goals and what you expect from them, they're going to follow those. We did a study where we had everyone see who could post the most charges in an hour, the most payments, and do the most AR follow-up. We kind of had it as a contest. Well, then we took the highest performer, and that was the new benchmark. So it worked out really well. This is back when we were in an office. Those same benchmarks are the same at home. But we then took that, we had that person kind of talk to other people who maybe had lower numbers and just say, here's the steps I left out that weren't needed. Here's the shortcuts I knew to where they could do more and do it efficiently and correctly. So yeah, just however you monitored them in the office is how you're going to monitor them when they go home. I don't know that should change, and I bet you'll see the productivity go up. Ours almost doubled when they went home. So I think those interruptions were more than I ever thought when they were in an office setting. But they're just very clear and very direct and just want to get to projects. Sometimes people need a little help. I have reports that come out at the end of the day, and I can, give them a call the next day and say, wow, you weren't able to get through much today. What was holding you back? What was hard? Where'd you get stuck? And they tell me this really horrible story about a payer that never answers the phone and doesn't have online access, and the mailing and the electronic claims, nothing's working. So, can we go another route for that? But the same written job descriptions that you had in the office of what their jobs are, what you expect them to do, that's the same. The employee handbook of all the guidelines to follow, all of your policies, what you expect from them, your HIPAA policies, everything that was in those is the same. And the compliance manual. Our compliance plan, which I thought was, I've had it probably 10 plus years, I thought it was so good and it covered everything. And then we went through our compliance accreditation and I found out my book was great, but it wasn't, I mean, I needed to be redefined a little bit. So now we went through that program. They handle all the training of the employees, the courses, the changes every year. But having those expectations out there, I think, is super important. I think it's less of a scare for people when they're going home, like, oh my gosh, what am I expected to do now that I'm at home? Well, what the same thing you were doing before. It's, I would guess that's what you should be doing now. I haven't changed your job. Right off the bat, if they had to walk out the door and the time clock is on the wall in the building, you're not going to have a way to record time tracking. So payroll companies some have time and attendance. I know Hani mentioned to me one that she likes. There's a lot of ways to track their time for payroll. And any human resources features, if you want your payroll company to handle that for you. I know when we hire, everything's electronic, but that's because I hire in different states. And so I need to have them be able to access that. When I hire an employee in a new state, I just contact my payroll company. I use ADP. It's just one that's out there, and say I need to start with employees in, say, Michigan. And then they send me the links for those employees. Now, bigger companies that are sending everybody home tomorrow, I don't think they're going to go to different states, but over time they might. I kept mine, and it turned out they were in different states because they'd moved to buy a house in another place that's much more economical. Husband got relocated. I could keep them, and then they would just, I would just start doing payroll in those states. I found a work comp carrier that covers multiple states. I just contact them and say, add this one to my policy, and they do. Health insurance benefits, some people have nationwide coverage policies they can get into. Other people have local, but they're still covered. It's just different. So broker, don't try this at home. Use your payroll company if they do it, or get a broker to look up policies for you and find the best benefits. When I have to hire or want to hire, I also use offshore. I tend to push a large majority of the work to them, but if I need to hire a manager, it's really nice to be able to place an ad with no state or city mentioned. I just put it out there that I'm hiring. It's from anybody, anywhere. So if you have a hard time finding good talent in your city, that is no longer a problem when you're remote, because you can hire from anywhere. I do ask different questions on a remote hire. The first one I always say, well, I don't know if this applies anymore, but I used to say was, if you're looking for social interaction in your job, this would not be the right one for you. We don't have an office. There's no brick and mortar building. You can't go in and talk to each other. So if you're someone that needs that, you might want to look somewhere else. We are all at home. I don't have an office setting anywhere that they could come to. So just let them know that right off the bat. But, do they have a lot of initiative and self-discipline that they can work from home? They're setting their schedule. They are driven to get the project done, and they don't need you to prompt them and throughout the day or the week to, unnecessarily to say, are you sure you're working on that all right? And, they have to just get in, get to work, and feel good about that. So I don't think there'd be a lack of people to hire for a remote company right now at all. I think as long as they have internet, um, they're pretty good to go. So the reasons I did it, number one was the productivity. I didn't like that when I left the building, when I came back, everyone was in a little huddle, and it wasn't a work question. They were they were talking about everything under the sun, and breakfast was a whole event. And it was one of the reasons I didn't want to do that anymore. I wanted people to feel motivated about their work and not distracted. So we had our heater and air conditioner wars. Oh yeah. Oh yeah. This one's cold. This one's hot. Office politics, the amount of time we spent on the dress code would be scary for anyone to even know. She wasn't wearing the right outfit. Her flip-flops don't have bling on the top, so those should not be allowed. It was ridiculous. And they weren't my policies. They were my partners at the time, but I didn't agree. We don't have that anymore. I don't care what anyone's wearing. If they're hot or cold, that's up to them. Interruptions, or turn off your phone while you're working so it's on vibrate, and don't listen to pings if social media puts another thing out. So they don't have to drive to work. The cost of gas these last 10 years has been high and ridiculous, especially in California. Some don't have cars anymore. They just use public transportation when they need to if they're in a city. So that has saved them a lot of money. They don't eat out at lunch at restaurants the same. They eat at home, which they eat then healthier and don't spend as much money because it's just easier to prepare. They do a lot of food prepping. I do as well. It's just kind of a thing on Sunday. You prep your meals, so it works out really well. They're not out sick very often. I actually have one employee out sick today. It's a rare thing for us, but she's on her way to the ER. She's very sick. So if they can't crawl to their desk, to their chair, they need to not work. But they're not spreading anything between each other when the normal flu season was around. And that was really nice. So not a lot of people out sick. And weather conditions, like I said, I do have one in Michigan that gets snowed in. That's not a problem for her right now. So she, every winter, just works from home. She has a local kid shoveling for her. And so, but it doesn't prevent anyone from going to work. But then, as I said, when they move out of state, you can keep them, which I have done a lot because training new employees is very time consuming. So they have been happier and healthier since going home all those years ago. They took up hobbies, different hobbies, lost weight. You don't go home at the end of the day and you're exhausted. You are done at the end of the day and want to get out of your house. So then they take off and do things. And I think the quality of their life has been, when you're not on lockdown in your house and you're voluntarily being there, the quality is very nice for your family, for teenage kids coming home. You're there for them. And I mean, I work with my husband as well, and he's in the same house I am. So we had to do some adjusting with that. It's similar to when people retire, but we got the hang of it. So yes, it's worked very well for us, and now I think it's going to work well for millions of people doing it. So we'll just have to see.
In the interim, we are a community. Many of us are friends, many of us know each other, we see each other at conferences. Now's the time for connection and friendship. We're social beings that like to be social, most of us. And so please, I encourage you to reach out to one another. We have our private Facebook group. I think we have about 60 members in the Facebook group. But if there's someone that you want to reach out to Roxanne, I know she's always available to talk to you. I see, a bunch of other people on this call. Bob Burley is here. A bunch of our clients are on the call as well. And so many of you that are active and participating and want to be good leaders and want to have as much information as possible. So please, please talk to each other, support each other. We're really, really all here for each other in this time. So I send you all of my blessings. Stay safe, and we hope to talk to you all next week on our next call. Thank you so much for listening. For more information on how to grow your business, visit our website at 4dglobalinc.com. That's the number 4, the letter D as in David, global, GLOBALINC.com. Click on the Owners Academy tab for more videos on sales, marketing, operations, and leadership. If you are in the healthcare space and would like to learn more about how to get started with an employee in India, or how to start a risk-free free trial with 4D Global, click on the Get Started for Free button on our website to book a time with someone on our team. See you next time.